Hello everyone, my name is Mohammad Jafrani. I am a psychodermatologist and professor at Central Michigan University. Today I would like to talk about a very interesting and fascinating topic that is psychodermatology, which is the connection between psych and skin. About 40% of dermatology outpatients they present with some level of psychological implications, and these psychological factors are involved into the initiation, aggravation, and perpetuation of variety of skin disorders. The research has shown that about 40% of dermatology outpatients have some level of psychological factors are involved. In this lecture, I'm going to talk about how to classify psychodermatological disorders. I'll also briefly talk about some common psychocutaneous disorders and their management approach. Thank you.